Senator Rosen, please.
Well, thank you, Chairman Reed. I appreciate you holding this hearing, and I really want to thank the nominees for being here today, for your willingness to serve and do these jobs here in our country. I want to talk a little bit about, just switching gears altogether, our mental health resources and support systems, because we know how important they are. It's critically important for our service members, particularly in my state of Nevada, for those facing the high operational demands at installations like Creech and Nellis Air Force Base, right? So given the unique challenges of these airmen, guardians, and their families they encounter, including the crews at Chief, they fly that remotely piloted aircraft. They fly the drones. They fly them in overseas combat. More needs to be done to ensure that they have adequate mental resources are available for that type of work. They're not in the theater, but they are, right? They're maybe piloting from Nevada. So Secretary Dalton, if you're confirmed, how would you further strengthen mental health support systems within the Department of Air Force? And specifically, what targeted initiatives could the department implement to ensure that our airmen and guardians, as well as their families, have better access to more robust support as the mission is newer missions, right, with technology?
Senator, thank you so much for raising this vital issue, and I believe that our service members and their families deserve the best possible care for their service and sacrifice to our country. Healthcare is also important for readiness of the force, and whether you're flying drones out of Creech Air Force Base or you're deployed in the Indo-Pacific, there are unique stressors that may be particular to the individual, to the unit, and we need to be cognizant of that variation across the force. And so I believe that we need to take deliberate efforts to destigmatize mental health. So, and there's more that certainly can be done in that regard. I know the Department of the Air Force is working to implement the Brandon Act, working with Congress and OSD to implement that. I think that will go a long way to providing more programming and access for those that are experiencing mental health issues. And we need to lower the barriers for those that are seeking help as well, to ensure timely access, to ensure that resources are targeted for the particular individual, and also given the national shortage of mental health providers, we need to be able to connect the right people in the right place. So you have my commitment, if confirmed, to address this.
I want to keep on this just a little bit, because I want to talk again about the remotely piloted crews like at Creech. They are eligible to receive mental health services, but for them, when they hang up their uniform and leave the service, there is no identifier on their record for their combat operations, although they're flying the plane in combat operations. So they aren't allowed to receive their guaranteed mental health services through the VA. Of course, in FY24, the NDAA included my amendment that requires a report establishing a combat status identifier so that RPA crews, well, they have something to justify their need for mental health services from the VA once they complete their time in service. So if confirmed, how would you seek to rectify this kind of unique problem?
Senator, thank you for highlighting the unique features that are facing the service members serving at Creech, and you have my commitment, if confirmed, to understand what more we can do in terms of creative solutions to ensure that there is equitable access to mental health programs and resources.
Thank you. I'm going to move on now to Dr. Erickson and talk about maintaining our defense technological edge, because global competition, declining R&D, contracting challenges, and the STEM workforce gap, well, these are just a few of the impediments that we know are eroding our technological edge over our adversaries, particularly China. Compounding these issues is a lack of available and easy accessible private capital to support defense-focused small business, which has stunted growth and innovation across our country. So, Dr. Erickson, if confirmed, you would oversee an extensive portfolio that includes the small business innovation research and small business technology transfer programs, both of which are crucial for fostering innovation across the defense sector. So can you talk about how this public-private partnership model helps scale defense contracted small businesses? We have a lot of those in Nevada. And what can you do to ensure that that is continued and their continued success?
Senator Rosen, thank you for kind of highlighting all of that's under the particular portfolio for this role. And if I'm confirmed, I'm committed to really supporting the small businesses. It's something that I've been doing for some time at the NASA Goddard Space Flight Center and for the agency. I mentioned before that it actually is the backbone of the country, and that's why it's such a critical component. They offer unique ideas in these small businesses, and what I see is really listening to them and hearing the issues that have really sort of retarded their ability to do it in a timely fashion. Ultimately, we want to transition these components, or in what we say at NASA, infuse them into our missions. I want to also be able to really reach out to the younger generation, graduate students who have that ability to apply for the STTR programs as well. I had one in your state this summer, Abraham Costada, and he was from Nevada. He also had issues with the mental capacity with his family members, and so I'm very sensitive to how we treat our people and how we can infuse them and partner with this STEM ecosystem that you mentioned. So I hope that I look forward to really working with you in your state and reaping some of the rewards from Nevada.
Well, thank you. We don't get enough of those awards, and so we look forward to you coming to Nevada and talking to our businesses so we can contribute as well. Thank you, Mr. Chairman.
Thank you, Senator Rosen. Senator Scott, please.